All right, now we're going to switch over to healthcare. With healthcare coverage linked to higher workforce productivity, businesses need to be involved in Medicaid expansion conversations. 110,000 Montanans fall into the coverage gap. With incomes too high to qualify for traditional Medicaid, but too low to afford health insurance or qualify for the insurance exchange, we need to address this. I would like to welcome our moderator, Bob Olson, who is President and CEO of the Montana Hospital Association.
I'm Bob Olson from the Hospital Association. I want to first say thank you for inviting us to bring this important issue to you. Our panel includes Representative Ed Buttrey, representative from House District 21 in Great Falls, John Goodnow, who's the President and CEO of Benefis Health System, and Sherry Taylor, who is the CEO of Logan Health Cut Bank and Chester. So those are the three panelists that will address the issue today and answer any of your questions at the end, if we have time. Just so that we kind of set the stage, I entered healthcare a long time ago, about 40-something years ago, and I didn't know what Medicaid was. So if you're sitting in the audience and saying, well, I'm not quite sure what Medicaid is, I thought I'd set the stage by at least getting us on common ground of what Medicaid is. Medicaid is a federal-state partnership delivering healthcare services to low-income residents. That's how it started back in 1969, part of the Great Society, right after Medicare. It's Title 19. So what does it do? Well, it is a program that traditionally covered healthcare services for people who were aged, typically over 65, that were blind, that were otherwise disabled. It also included some very low-income adults. In Montana, I believe the benchmark was below 25% of federal poverty. And it includes coverage for pregnant women and low-income children. So that was traditional Medicaid. Now we have the expanded program that was part of the Affordable Care Act that allowed states to extend Medicaid coverage to their residents 19 to 64 years of age, but whose incomes are below 138% of the federal poverty level. Now there's a financial difference that's not insignificant. Traditional Medicaid has a match rate where for every dollar of health care that's delivered, the federal government in Montana supplies about 65 cents. And the state brings up the rest of the 35 cents. With Medicaid expansion, for every dollar that's been delivered for health care, the federal government supplies 90 cents, and the state makes up the last 10 cents of every dollar. So it's a 90-10 program. Now we talk about the eligibility at 138% of poverty. The individual poverty guideline at that level is $20,120 a year. That's about $1,675 a month, and then you can make about $9.67 full-time to hit that income level. So if it's a family of three, we're talking about a family that has income of about $34,300, and that translates into just under $3,000 a month, and it translates into a family income of $16.50 an hour. So we are talking about people without a lot of income. And so when we look at the numbers of people that are on the program, as of October, the state reported there's 90,000 people on the program now. You heard 110. Since the end of the pandemic, the state's been redetermining eligibility. They hadn't been able to do that for 3 years while the pandemic and emergency declaration was in place. And now they're working through, so we're about 90. We think that the state will probably end up with somewhere more traditional like we were before the pandemic, with 75 or 80,000 people covered under the program. So that coverage gap and filling that, what did it do? Well, people who don't have health insurance in the United States typically are on their own to find a way to get care, but they also typically forego getting care. So preventative services, screening services, things like that that you're going to have are things people just do without. And then when they do have healthcare services that they require, if they've put off low-grade types of illnesses, they end up with more immediate needs, and they end up with more intense needs, and they end up in the hospital's emergency department or in other clinics where they try and get their care and pay what they can, up to including nothing, because they have nothing to buy healthcare coverage with. So we've benefited greatly from that greater access to care over the course of the few years that it's been in place. We passed the bill initially in 2015. So come next session, 2025, it'll be approaching a 10-year-old program for being reauthorized. So that's what Medicaid is, and that's what expansion is. So now I want to turn to the panelists and have them give their take on Medicaid expansion. We'll start with Representative Buttrey, and maybe you can just tell us how you came to be interested in Medicaid and why you got involved in this particular endeavor.
Yeah, thanks, Bob. Just like Bob, when I started in learning about this process and discussing Medicaid, I knew nothing about health care. But I'm a small business guy, and I felt like it was just a really cool thing at the time for a Republican legislator to get into. That's a joke. But seriously, I was growing at that point a number of small businesses, and one of the biggest needs that I had was for entry-level employees. And I was having a lot of trouble finding reliable entry-level employees that could help me grow my business to the level I needed to grow it. And as I kind of dug through the numbers, I was having to hire 3 or 4 of those workers just to be able to retain one worker that could help long-term benefit the company. And I wondered why. And as I really dug more into it, I found that many of these workers were unhealthy, either mentally or physically, or many of them had addictions. And they didn't have access to preventative care, counseling, or other services that they would have had they been insured, but they didn't have access to any of those services. And so it quickly dawned on me that if you have someone that is unhealthy, either mentally or physically, or they're addicted, they are not going to contribute to the success of your business, and they're certainly not going to be able to contribute to their own success or the success of their families. So at that point, I thought, well, I better get involved. I better think about doing something. Now, make no mistake, Medicaid expansion is fraught with politics and ideology. I heard the folks talk this morning on the tax policy that it's fraught with politics and ideology. Well, here, hold my beer. Okay, because this is a big, big deal. Now, none of us want government involved in our businesses or anywhere else, that it absolutely doesn't need to be involved. But healthcare is so complex and so expensive that for a lot of our population, without some sort of help, in this case governmental help, they're simply not going to have access to those services. But we also had to realize that prior to Medicaid expansion, if someone needed healthcare, they got it. They just got it at the wrong time, when they're already chronically ill in many cases, at the wrong place, which is in the emergency rooms, and in the most expensive way. Now, here's the other thing. They didn't pay for it. Everyone else got cost shifted those dollars to pay for that service. So they're getting health care, but if you talk entitlements existed prior to Medicaid expansion. And that was one of the things we were trying to fix. So knowing this, I was hoping that there was a way to craft legislation where we could make Medicaid expansion an economic development program, one that would help benefit our businesses by getting us a larger and more reliable workforce, and also do it where people had access to preventative care and other services for mental, physical, or addictive problems. And the problem was we had to try to develop a good solution using a one-size-fits-all law from the feds, and I always kind of equate it to trying to build a really great project with a really crappy toolbox. So that's where we were. We did get it done, though. We collected a lot of data, and it's worked real well. So quickly, I want to go through what Medicaid expansion means for the state budget. Well, Medicaid expansion, if you look at the costs, the total program costs are $2.15 billion per biennium in Montana. Now, out of that, there's $82 million per biennium from the state general fund. There's $55 million in state special funds, and then the hospital tax contributions about $60 million. Now, in the legislature and in many places, we always talk about the costs. Here's the cost of Medicaid expansion. But as a small business guy, and there's a lot of business people in this room, we don't just look at the costs on our P&L, do we? We look at the revenue also. So we wanted to collect data and said, we know how much it costs. Everybody knows how much Medicaid expansion costs. But what is it doing for the state as far as revenue? So its cost is $82 million to the state general fund. Revenues, I'll just quickly go through some of this. There is some savings in moving folks that were previously covered by traditional Medicaid to expansion, like pregnant women. The state savings for that, because of the higher Fed match rate, is about $30 million. We had savings for substance use disorder and mental illness inmate medical treatment. These were dollars that were paid out of the state budget prior. Not much. I mean, we were able to get a lot more coverage and help from the feds. That saved the state $14 million. The state administers a hospital utilization fee that brings in $15 million. And then, of course, because we created 7,500 ongoing jobs from this program, $475 million in personal taxable income created, the tax dollars coming into the state from folks within this industry increased, and that's about $50 million. So we invest, our cost is $82 million. The biennium revenue to the state's about $109 million. Guess what, folks? This program makes the state $27 million. So as you're thinking about that number, you want to realize if we don't have this program, we're either going to have to raise your taxes or we're going to have to cut programs to make up that gap in the budget. There's some other non-state budget benefits. I'll quickly go through them. There's a hospital utilization fee. That's money that comes back to the hospitals, and that's simply used to pay for the cost of providing the service, because if they can't pay for the cost providing service to these patients, then the cost shift it to everybody else. So that helps them balance the books. We had zero closure of critical access hospitals in Montana, one of the few states that can boast that. We had an increased availability of behavioral health and substance abuse services. For behavioral health, prior state funding was $5 million. Montana taxpayer money, $5 million. That's what we had for mental health. Now with Medicaid expansion, it's over $70 million. And we all know how important mental health treatment is. We saved Montana businesses the cost of insuring low-income employees. 89% of our accommodation food businesses have Medicaid expansion workers. 67% of our retail businesses, you have workers covered by this. 54% of construction, workers on expansion. And bottom line is we increase the availability of a reliable and healthy workforce to our Montana businesses. That's why we did it. That was our goal. I think we've achieved a lot of those goals. That's why I got involved, and happy to be here today. Thanks, Bob.
Thank you for those remarks. Sherry, I think this is turning on. Is it on? You can hear this okay? All right. So appreciate those comments. Sherry, you've been the CEO in Cutbank for a number of years, and I'd like you to remark on what the circumstances were like when Medicaid expansion started and how it has impacted your community and your facility.
You bet. Simply put, it kept our hospital open. And we were providing, as Ed said, the care for the community, but it was uncompensated care. And it was coming through our ER, and we were taking care of it as much as we can. And prior to that, we joked about it. We didn't, count things in days cash on hand. We counted it in hours. It was devastating. It wasn't that we didn't have volume. It wasn't that we didn't have it there, but it was coming through the ER. It wasn't coming through outpatient. It wasn't in preventative care. It wasn't in other pieces. So it was really, really expensive. And so we really, really struggled. After Medicaid expansion, we were able to get paid for the care that we did provide. And we were able to have financial stability in place so that we could continue to move on to providing critical access services to our community. And we were essential because if we shut down, then there was no health care of emergency, physical therapy, scopes, outpatient procedures that could be done, and people would not have that. And a lot of the business community really recognized that. So prior to Medicaid expansion, we had 2 times. One time, obviously when you're counting your days by the hours, cash on hand, it's a little bit difficult getting loans. And our business community members stepped forward and co-signed at $20,000 a business for a $250,000 loan for that hospital to stay functioning. And then at a second time, we had our community members step forward and provide a loan to the hospital for $500,000. And that kept that hospital going. And when I asked the True Value and the business people in the community, why would you do that? Why would you risk that? And they said, we have a lot more to risk if we don't have health care in our community. To Ed's point, we don't have workers. People are not going to move in. And they're not going to be able to stay working and providing the workforce that we need to do our businesses if there's not a hospital. And so for us, if we lost the $20,000 per business, that was a drop in the bucket. We were going to lose our businesses completely if that healthcare didn't stay in the community. So it was a major, major point for us. And we really we're so thankful the community had our back and our support. And that was the only reason why there still is a hospital in Cut Bank.
Okay, I appreciate that sentiment. Well, John, let's have you weigh in on the impact it's had in your community.
So, to me, Medicaid expansion has been a big-time triple win. And I think the first thing we have to mention is that it's really been good for the people that have coverage now and didn't before. Because being without health insurance is not a good thing in the United States. And so there's a lot more people covered now than there were before. So that's one win. Another win, and Ed covered it real nicely, was for the economy of the state. And it's not just the state budget. The money that's brought into the state has an impact in every community in the state of Montana too. So it's got a great economic impact for state budget and all the communities. And then the third thing is it has helped the providers, the people that provide the services to the folks that didn't have insurance before, and now they do. And let me tell you just a little bit about how the hospital finances at a big place like Benefice work. And around Great Falls, there's a lot of relatively poor people. And so we have kind of a unique payer mix. And Ed mentioned nobody likes government to be in your business. Let me tell you, they're in our business, because about 80% of all the patients that come to Benefice are covered by governmental insurance. And that falls into four categories at Benefice: Medicare being the biggest, Medicaid second, Indian Health Services, and then the folks at the base. So 80% of our business is paid for by the government. What we don't make on those governmental payers or uninsured gets shifted over to commercial insurance. And Ed mentioned that too. So for you business owners that provide coverage for your employees, you're paying a lot more than the governmental payers are. And if the Medicaid expansion were to go away, your rates would go even higher. So it's been a really good thing. And the more people that are insured in the state, whether it's Montana or anywhere else, the less cost shifting you're going to have over to business owners, and not only the business owners that pay part of the premium, but those employees that pay the rest of the premium. So it's been a very good thing from all of those perspectives.
So I think that the case is made for the positive impacts that it's had throughout the state. Certainly it has stabilized the financial condition of hospitals. But, hospitals aren't the only provider group that are benefited by Medicaid expansion. It touches on all of the primary care clinics, physician offices, all the pharmacies, all of the various therapists. And so, yeah, you hear a lot from the hospitals, but it's more than just the hospitals that are benefited from this program, and certainly it's touched the lives of hundreds of thousands of Montanans. So let's turn around and talk about what happens in 2025, and what's the potential, and how does the community react if we undo this? If we don't have Medicaid expansion and we withdraw about $1 billion worth of revenues out of the Montana's provider community and recast those folks as uninsured, how does it work when you come back home? Sherry, would you like to lead us off?
Sure, it's huge. 27% of our total patients are Medicaid expansion. But in behavioral health, we see 34% are Medicaid expansion. And everyone thinks, wow, that's a lot, and it is. And I will tell you, though, but what's at stake is by having financial stability, we were able to bring in behavioral health services. And the ones who would really be hurt the most is the 43%, which is commercial and other payers that utilize behavioral health services. That if we are not able to have the Medicaid expansion population covered, and that becomes non-compensated care, we won't be able to keep that service open. So it dramatically affects everybody. In our county, we were one of the largest counties with the highest percentage at 16% of our population. But as I said, 27% of our population, of our total patients, are Medicaid expansion. And I'll give you a very good story. We've had some patient stories where prior to Medicaid expansion, they didn't have services or payer source, and we didn't have behavioral health services for them. And there were patients who their household had an income but didn't have any coverage. And they were able to get in and with our behavioral health services, be able to receive the tools that they needed. And they then became fully employed and became a commercial insurer. And so they came off and now are looking at going back and getting education. So it helped them come from being completely unemployed. The household did have an income, but it helped them to move through that. And our therapists will tell you that there's stories after stories of that in helping these people. But it's not just Medicaid expansion, because if we shut down those services because we can no longer do them, then it's the whole community that actually loses the service throughout. And that's what we see. We also have a lot of expenses, and that we struggle in our county is because there's not transportation, and they don't have the ability to get that transportation. So a lot of them will, if it's not in our county, if we don't bring it there, they are not able to go elsewhere. And we see that now we bring scopes and preventative services, and so people are on a waiting list. We've offered you can go elsewhere to get it, and actually most places do have one, but they can't afford it. And so then a lot of times what we were seeing was that they were not getting the preventative services that they needed, and they were ending up in the ER and really expensive, and usually having to be transferred out to larger centers with really big cases that could have been prevented in the first place. But now we're seeing that to shift, where they are going to the outpatient, they are getting the preventative treatment. And the biggest thing that we saw in our county, and it was interesting, is that the business community really came forward and told me how much they are supportive of Medicaid expansion, and that's because 64% of the businesses in Glacier County have employees who are on Medicaid expansion. And so it's keeping their workforce in their businesses because they're not out sick or in a critical situation. And it is helping that when we all are struggling with workforce. So a lot of those things have been an incredible benefit. But also, in a study, the Medicaid expansion in Glacier County added 53 jobs, and it was $2.8 million in labor income, which is huge. And that's why the community really stands behind and supports it, because they know the impact that would happen in our county if something were to happen to us, which also equated to $7.7 million in annual economic output for Glacier County. So all of that is at stake, and it is a huge importance for us.
So, John, your hospital serves far more service area than Cascade County. What happens in your community and to your services if we lose Medicaid expansion? Well, how do you react?
Well, our uninsured rate would about double. And when you treat an uninsured patient, usually that means you're not going to get any payment whatsoever. So as we've already talked about, it would increase cost shifting. I mean, that's just the way the U.S. healthcare system works. And it's a stinky way for it to work, but that's the way it works. What you don't make on a governmental payer, you shift over to other people who can pay. So everybody else's rates would go up. I mean, it really is that simple.
Okay, so Ed, we're kind of back to you now. You've done a lot of work to get this in place. The Montana economy has benefited from it. What's your take on what happens if we unwind this beginning next July?
Well, I think I'll look at it again from a business perspective. I'd given you numbers before showing the mass amount of Montana businesses that rely on Medicaid expansion for health care of their workers. So you take that away, and I think as a business, to be competitive and to keep a reliable workforce, you're going to have to start providing that health care for those workers. And throughout Montana, I think the number was somewhere between $350 and $740 million is what Montana businesses would have to come up to. Secondly, you're going to have a workforce that is going to lose their access to preventative care. So this is a short and long game. Certainly in the long term, if someone is not getting preventative care, they're going to have long-term chronic health issues, and that's simply going to add more cost to the system. It's going to, again, give you a less reliable workforce. There's just no upside to that. You want to know that your employees are taking care of themselves medically, mentally, physically, and taking care of addictions. I think about communities like Sherry was talking about in Cut Bank. You take that hospital out of Cut Bank because it's not financially feasible. How attractive is Cut Bank going to be now for businesses and for people to live there? How good is it going to be for those folks there that if they have an issue, they're either taking a ambulance ride on icy snowpack roads or a helicopter ride so they can get health care? I think that's awful. And then the last point, because this is a profit center, if we get rid of Medicaid expansion and leave that $27 million in last year's fiscal year dollars, $27 million hole in our gap in our budget, where are we going to make that up? What programs are we going to cut, or who are we going to tax more? Because that will be a gap in our budget that we have to fill. And I think usually when we do things in government, it has an effect on our citizens and our businesses, and I don't want to have to play that game.
So the one thing about a program like this, the very nature of it, it has attracted a lot of political dispute. And there's things that have been said about the program. People believe the program causes certain impacts and has its own flaws. So Ed, around the Capitol, what are the things about what gets said at the Capitol that you'd like to set the record straight for?
Yeah, thanks, Bob. And I think it's important. I'm a data guy. You know, I crafted and sponsored this bill in 15, then again in 19, but I'm a data guy, and if the data shows that it's not good, it's why we measure it, then I'm going to be the first guy saying we need to come up with something else. But it really bothers me when we hear the untruths. Usually comes from the ideological sides, either left or right, but it's folks that don't do the hard work to figure out what's going on, and this is an easy thing to believe. So there's a couple of them here I've written down. Once Montana's on Medicaid expansion, we're on the program forever. We can't get rid of it. It's absolutely untrue. First of all, there are triggers in the bill that says if the federal funding changes, then the legislature would have to take a vote to approve continuation of the program, or the people using the program would have to make up for all that change in revenue or the change in costs in the program. Otherwise, the program goes away. Oh, by the way, the legislature every 2 years, every time we meet, our appropriations committee folks have to approve the acquisition of the federal money and the spending of the state money. And just like a lot of places in code, if the appropriations committee say, we don't want to fund Medicaid expansion, the program goes away because it simply becomes an unfunded mandate. So we are reauthorizing this program every 2 years, and without legislative intent and approval moving forward, it simply doesn't. So it doesn't last forever. Myth number 2, people on Medicaid expansion don't work. We've heard that since day one. And our Department of Labor and other entities have looked at what's going on in the businesses and the people that are working. Currently, 76% of Montanans on Medicaid expansion are working. Another 6% are attending school. And of the remaining 18%, the majority are either caretaking for family members or are simply disabled and unable to work. So we do have, I think maybe our average is a little higher than a lot of places, but in Montanans, the vast majority of these folks that are on the program are working. Third myth, once someone is enrolled in Medicaid expansion, he or she will never leave the program. That is contrary to everything that we did as we crafted this. We wanted to craft a solution so that would give people job skills, economic development training, personal skills, and get them healthy so they could succeed in the workforce. And as prior to the pandemic, as we saw that economy grow, we saw our Medicaid rolls drastically drop. Economy was good, Medicaid rolls dropped. Economy bad, pandemic hits, Medicaid rolls go up. Prior to the pandemic, the average length of time for a user on Medicaid expansion in Montana was less than 24 months. So people were moving off of the program just like we intended them to do. And I think the final myth I'll talk about is Montanans as a whole do not support Medicaid expansion. Our good friends at the Chamber have done some surveying on that, and a survey that was conducted by the Montana Chamber in 2023 shows that 84% of Montana voters support the continuation of the program. So we just got to deal with reality. We got to deal with facts and data, and if we do that, I hope we can make good decisions. Although it's going to be a struggle in this next session.
John, what's your thoughts, John?
Well, as I mentioned earlier, anytime you have more people covered, it's better. And one of the myths that around is that, oh gosh, Medicaid expansion's been a gigantic boon to particularly the big hospitals like Benefice. And yeah, I tell you what, in 2022, I'll tell you what our operating margin was. It was 2.24%. It's not bad, but it's not anything to leap up and down about. And in 2023, it's a work calendar year, so 1.5%. So it's not like we're rolling in the money. And let me tell you, Benefice is doing well compared to most of the state's big hospitals. A lot of Montana's hospitals are losing money right now, which is not a sustainable thing. So it hasn't been a boon. And on most hospitals, on any governmental payer, whether it's Medicare or Medicaid, lose money. And then they cost shift it over to the commercials like we've already talked about a bunch of times. Benefice breaks even on Medicare because we did a huge cost reduction thing so we could break even on Medicare. But we still lose money on Medicaid. So losing money on Medicaid is better than somebody with no insurance, but it hasn't been a financial boon to particularly the big hospitals. It's helped, but that's different than a boon. It's a good thing for the state in general. And to me, if you just think about it from a common sense perspective and all the different kind of sides we've talked about, it makes all the sense in the world from a common sense perspective to continue Medicaid expansion, and very little sense, common sense wise, to not continue it.
Okay, Sherry?
All right. Well, I think for me, and what was really impactful in our county was that Medicaid is just another entitlement program giving health care away for free. We were given health care away for free. We have been for years, but we did it at the highest cost and at the most expensive way. And for now, we are finally doing healthcare in a more economic way because they have a payer source to help them get through the right mechanisms. And it makes a big difference. And when we were doing it for free and entitlement prior to Medicaid expansion, for real free, the local economies were the ones having to pick it up. The business owners were the ones having to co-sign our loans. It was the community having to put the money up there for us to keep on operating and going. And they just came through the ER and we had to take care of it. And we We cannot do justice for behavioral health through the ER. It's not the right mechanism, and we had no stories of patients coming in, getting the treatment that they needed, getting so that they could be fully employed and on commercial insurance when they were getting their behavioral health through the emergency department. And I tell you, going back to the days where, as a critical access hospital, our patients are less than 96 hours in our hospital, that's what our days cash on hand was, and we just can't go back to it. We would have to change things and discontinue access.
Okay, so we have a few minutes for questions. If anybody has questions that you might want to pose, anything we haven't touched on?
That's my cue. Way back in the back. I got a question while I'm heading back. How come some of the hospitals are moving into each other's geographic areas? I live in Townsend, and we were trying to keep a little hospital open with bake sales and stuff, and now all of a sudden we got two of the major hospitals in the state camped out in little old Townsend.
Well, you know what they say, competition's good, so.
Great. My name is Allison Corbin. I'm with Montana Economic Developers Association, and I'm just curious about the senior and long-term care and how that plays into Medicaid expansion, especially since we've seen so many long-term care facilities close, particularly in small towns, and also how that plays into our workforce, because even the other day I was at my workout class and one of the ladies said, I dropped to part-time so I can take care of mom and dad. So I'm just thinking about that as far as our aging population in Montana, and curious how you guys are viewing that.
That's a good question. So the traditional Medicaid program covers the folks that are in the nursing facilities. And so the traditional Medicaid program doesn't get reauthorized per se next session. So the issues that industry faces will be in front of the legislature like everything else, but it's a traditional Medicaid. The Medicaid expansion cuts off at 64, so there's really not a nursing facility exposure for that population.
Bob,
Last question.
I wanted to add something to that is for those folks that are having to take and reduce their hours or potentially not work because they're taking care of an elderly family member, Medicaid expansion does work for those folks so that they can take care of their family member. Even though their income has been reduced, if they fit into that window, then they would be able to get the preventative care and other health care services that they need.
Hi, Jill Alessi with Mountain Pacific. Great discussion, a lot around costs, budgets, access. Me, from a registered nurse component, have we looked at the health outcomes associated with this and the risk scores pre-Medicaid expansion versus post to see if it's a healthier population and our population health is improving with the program as well?
I can tell you this, that the department does track all the numbers of people that have had vaccinations, immunizations, preventative screens, the number of people that are getting those kinds of routine screening services that are going to detect any kind of issues sooner, and they keep track of that. So that I would say that that's the evidence that people are accessing care more appropriately and focus more towards wellness. The other thing is all those mental health services are really making an impact on making sure people have sustained access to health care. And give you this example because it's always been a frustration for us. So if someone comes into our emergency room, we can't get them stabilized and they end up adjudicated and become the property of the state of Montana down at Warm Springs State Hospital. It used to be when they got discharged their own devices, usually on the street. Go find care, go find housing, go find what you need. Now when they get discharged from the state hospital, they have a Medicaid card. They can access their prescription medications and stay at the level of stability they were able to achieve. So we're not just wasting our money in a blinding circle. So those are a couple of examples of improvements that we know about. Okay. I think we're out of time. Does anybody have a last comment you'd like to make before we leave the podium?
Well, Bob, I think from a legislative perspective, I would hope folks here have routine contacts. A beautiful part about Montana with your legislators And I would ask that you encourage them to find out more about how the program works, what the federal law is, what the constraints on Montana are, and to understand the risks associated if we choose not to continue the program, the risk to the small businesses, the cost to small businesses, the risk to the state, the risk to our state budget, and that $27 million gap that we'll have to backfill. We want to make sure that if we are not going to move forward with this program, that we darn well better have an alternative plan in place. Because if we abandon this population and have that effect on our Montana businesses, this is a cascading disaster. And we just, not saying that there couldn't be another option, but we better know what that option is.
I really just feel strongly that this is important to access in our communities for everyone. Because when services are shut down, everyone's access to that service is shut down. And so that's the importance for everybody in the community. It's not just for those who are on Medicaid expansion.
John, last word's yours.
I'll do this same thing I said before. It just makes common sense to continue it. It's a good program.
So everybody, I'd like to ask you for a round of applause for our panelists today. Thank you for your attention.